So I want to talk about how we're going to specifically engage in shared decision making during the TMACS choice trial using a decision aid that we've co-produced with a number of patient groups. Before you go in to see the patient and engage in decision making process, make sure you've got all of the information to hand. So you need to have got your first troponin result, you need to have made your first clinical assessment, and you need to have calculated the TMACS output. That will calculate the probability of an acute coronary syndrome. And let's say the probability is 5%. You then go to our file and pull out the decision aid that corresponds to a 5% probability of ACS. In the future, that will be digitized. Having done that, you then go into the consultation with the patient. That decision made is going to be your tool to inform them about the options for their care. You're going to use the 3-talk model, which I've described in another video, and then you'll present them with this decision aid. And you can personalize it, so put the patient's name on there. You can then take them through the decision aid, and you can tailor it to this individual patient. There's some standard text which tells them that we've suspected a heart attack due to the patient's symptoms, but we can also fill the box in with other causes that we might be concerned about, and we can have a discussion around those as well. We then explain what we've done so far in order to get information about the patient's condition. And that's all explained on this decision aid, which was co-produced with several patient groups and by going to patients who were actually in the emergency department or ambulatory care unit at the time to get multiple sources of feedback on the development of this decision aid. The middle 2 pages of that decision aid are going to be the really useful parts for the options talk that we do as part of our 3-talk model. So on the left, you can see how we illustrate the probability of myocardial infarction to our patients. Now we have to do that in several ways. So we've got a percentage at the top, we've got a pictogram in the middle, which visually demonstrates the risk. And then at the bottom, we've got a demonstration of, for every 100 people like you who come to the emergency department, how many will have a heart attack or a heart problem in the next 30 days and how many will not. That allows us to communicate the risk. And then on the right of the page, we can sort of introduce the decision talk. This is where the patient can introduce their own preferences and values. So we complete those 2 boxes with anything the patient might be worried about and what might be most important for them about their treatment. We then go through the options. So we recommend one option for the participant or the patient. In this case, we've got a decision aid that's used for a high-risk patient who has a 95% probability of an acute myocardial infarction or an event within 30 days. So option A is to stay in hospital and have treatment, and there's a discussion of why that is our recommendation. But we also present the other options: go home and come back for another blood test so that we can improve our certainty. But we also talk about the risks of doing that. And then we can talk about option C, which is to be discharged and return home without any further treatment. And in there, we talk about the risks that are involved with that and why it's not our recommended treatment option for the patient's health. On the last page of the decision aid, we come to the third part of the 3-talk model, the decision talk. So we can then enter what we recommend for the patient's care based on our protocols. So in this case, for our high-risk patient, we recommend option A, usually. We haven't put that in there because we need to have listened to what the patient has said in order to recommend an option. So it's still possible that the patient may say something that influences what we write in there. So it's left blank for you to fill out once you've listened to the patient. You fill out the option that you recommend for their care. We then talk about what's next, and then we come to the shared decision. So where we say that considering everything, the patient has decided in conjunction with us on option A, B, or C. And we talk about that. There's some advice at the bottom of the page on how to stay healthy. That's really important for patients. They told us we need to do better on advising them about ways to stay healthy and avoid being sick in the future. So that's in there. And there's also some safety netting advice just in case the patient has decided to return home. And that's it. The evidence of consent for the TMACS choice trial is this. It's evidence that we engaged in shared decision-making with the patient, and we must give them a copy. We must also provide them with a copy of the participant information sheet for the trial. And then the research team will do the rest. We'll follow up the patient, and we'll assess decision regret. We'll also assess how they did over the next 30 days.